Classification of wounds by Simplified Medico. First one is Rank and Wakefield classification. Based on this classification, the wounds are divided into tidy wound and untidy wound. Tidy wound, incised wound are known as tidy wounds. Clean wound without any tissue loss are known as tidy wounds. Suturing is done and healed by primary intention. Example, surgical incision. Untidy wounds, these are crushed or avulsed, contaminated, devitalized tissues often associated with tissue loss. Example, burns, lacerated wounds, crushed wounds, healed by secondary intention. So the tidy wounds, there is no tissue loss. In untidy wounds, there is tissue loss and they are crushed wounds. And tidy wounds are incised wounds. Based on type of wound, they are classified into closed wounds and open wounds. Closed wounds are bruise, hematoma, blunt injuries. These causes closed wounds. Open wounds are abrasion, lacerated, incised and penetrating wounds. Based on thickness of the wound, they are classified as superficial, partial thickness wound, full thickness wound, deep wound, complicated wound, penetrating wound. Superficial wound involve only epidermis and dermal papillae. Partial thickness wound involves skin loss up to deep dermis. Full thickness wound involve loss of skin, loss of entire skin and subcutaneous tissue. Deep wound extends to muscle and deeper tissues. Complicated wound involve injury to vessels or nerves. Penetrating wound penetrates into either natural cavities or organs based on involvement of structures. Simple wounds and complex wounds. Simple wounds involve only skin. Complex wounds involve mixed tissues. Based on time elapsed, acute wound show signs of healing in less than 4 weeks. Example, surgical or traumatic or both, or burn wounds. Chronic wounds does not show signs of healing. The chronic wounds are again classified into typical and atypical wounds. They typically include ischemic, neurotropic, hydrostatic ulcers, and diabetic foot. Atypical is caused by autoimmune disorders, infectious diseases, vascular diseases, and vasculopathies. And the last classification is Berard wound classification based on order of infectivity low to high. Clean wound are elective made under asepsis conditions. Example, hernioplasty and excision. The infectivity rate of clean wounds is less than 2%. Clean contaminated wounds are made during urgent or emergency cases. Controlled opening of a normally colonized body cavities with minimal spillage or break-in sterile technique causes clean contaminated wound. Example, appendicectomy, gastrojejunostomy, pancreatic and biliary surgeries. The infective rate is up to 30%. Contaminated wounds made during trauma or acute inflammation are known as contaminated wound. Example, acute abdominal conditions. Infective rate is up to 60%. Dirty wounds, wound with pus, necrotic tissue and fecal contamination are known as dirty wounds. These are caused due to purulent abscess, perforation with colonized bacteria, penetrating trauma more than 4 hours from injury. The infective rate is up to more than 60%. Okay, the summary of this classification is as follows. The first classification is Rank and Wakefield classification. Based on it, the wounds are divided into two types, tidy and untidy wounds. Tidy wounds are incised, clean wound without any tissue loss. Example, surgical incisions. Untidy wounds are contaminated and tissue loss is present. Example, crushed and avulsion injuries, burns, etc. The tidy wounds are healed by primary intention and the untidy wounds are healed by secondary intention. Based on type of wound, they are classified into closed and open. Closed wounds include BBH, bruise, blunt injury, hematoma. Open wounds include APIL, abrasion, penetrating injuries, incised wounds, and lacerated wounds. Based on thickness of the wound, they are classified into 6 types. They are superficial wound, partial thickness wound, full thickness wound, deep wounds, complicated wounds, penetrating wounds. So the mnemonic goes like SPF DPC. SPF DCP. Anything. Superficial wound involve only dermis and dermal papillae. Partial thickness wound involve skin loss up to deep dermis. Full thickness wound involve loss of skin, entire skin and subcutaneous tissue. Deep wounds extends into muscles and deeper structures. Complicated wounds involve it goes further to nerves and vessels, and penetrating wounds either into natural cavities or organs. So the first one, superficial, is only epidermis and dermal papillae. The next one is up to deep dermis, and the next one is entire skin and subcutaneous tissue, and the next one is deeper structures, muscles and deeper structures, and the next one is nerves and vessels. CVN, complicated wounds, injury up to nerves and vessels, and the next one is natural cavities and or organs. Based on involvement of structures, they are classified into simple and complex wounds. Simple means only skin is involved. Complex means mixed tissues. Based on time elapsed, acute wounds and chronic wounds. Acute means they show signs of healing in less than 4 weeks. Example, surgical or traumatic wounds. Chronic wounds means they do not show any signs of healing. Example, diabetic foot, decubitus ulcers. And the last one is Berard classification of surgical wounds. So these are due to surgeries. These wounds are formed, and they are 4 types: clean wound, clean contaminated wound, and dirty wound. Clean wound. They are elective wounds made under aseptic conditions. Example, hernioplasty, thyroidectomy. Clean contaminated wound made during emergency cases. Example, appendicectomy and gastrojejunostomy. And contaminated wound refers to wounds made during trauma or acute inflammation. Example, acute abdominal conditions. Dirty wounds refers to the wound with evidence of pus and necrotic tissue. And that's it, guys.